Good morning. I have a question for you. When you have a baby, a new baby, what comes to mind? There's all these feelings and aspirations of a happy childhood, a happy time, you know, the discovery, the camaraderie, the connection between a mother and child, and all these wonderful feelings and hopes and dreams that you have for your baby and the experience that you have raising your baby. But what if that actually becomes a complete and utter nightmare? That the hopes and dreams, the smiles and giggles, sugar, spice and everything nice becomes actually just disaster, despair and desperation. What happens when that happens? Here we have in studio one person who is here to shed some light in one of the biggest causes of that situation between a mother and child. Matters lactation and matters to deal with babies and how they feed and what happens when that flow, when that situation is altered in the negative. Today we have Susan. See, I know you.
Thank you.
Welcome.
Thank you.
But I would like you to introduce yourself to Kenyans.
Sure.
And tell us a little bit of who you are and what do you do, please.
Okay. Thank you, Victor. My name is Susan Mureithi. I'm a nurse by background. I worked and I trained at the Nairobi Hospital. And thereafter, I developed a passion for babies. Infancy is my core area. Infancy means from birth to 1 year old. And thereafter, doing nursing, I did train as a certified infant massage instructor and also lactation and breastfeeding consultant. And currently, I'm the chairperson of Infant Massage Kenya, currently trying to register a chapter in Kenya.
Okay.
Thank you.
All right. Thank you very much. Now, actually, the whole idea of when people hear about, particularly maybe men or something, who hear about infant massage,
Yes.
they may think, do babies have massages? But I believe even from a basic level, from the African traditional level, there have been some form of massage.
Yes.
I've seen women actually rub the backs of the babies
Yes.
and everything and
Yes.
everything. How about this? How about we start by actually, how about you paint the picture for us?
Okay.
What exactly is the problem? Tell us about the feeding problems and lactation and tell us what the problem, define the problem for us,
Okay.
as it were.
All right.
Yes, please.
I'll say something. When this bundle of joy comes to our homes, there are many things happening. There's the new member of the family, of the community, and there's some bit of mother-child relationship. Remember, when this child is born, there's a hormonal imbalance, which a lot of people ignore because ladies, after they give birth, because of the hormonal change, the imbalances in their life or their body is very evident. And this is where you hear a mother is not able to breastfeed or challenges come in because they didn't seek guidance or they were not shown properly how to latch on the baby. So we get challenges including baby refusal to feed. I have too much milk, Susan, what do I do? I don't have milk, Susan, what am I supposed to eat? And that's the major question I get. The other one, they say, my nipples are aching, they're hurting, they're bleeding. What am I supposed to do, Susan? And I'm here to tell Kenyans, even if you don't have a baby, you must have a relative who has a baby, and you can find support for them. Because other than the hormonal change in a woman's body, remember, this baby needs to feed. This baby has never fed from mother's milk before. So it's something new, and there's an art here that needs to be complete. The mother must know how to latch on the baby, how to attach the baby to the breast correctly. Because at first I thought, after my training, I thought breastfeeding is just motherhood, you know. Bring on the baby.
It's natural.
I
It's
put
just-
it on.
Yes.
There we go.
Yeah.
But when I got my first child, Abigail, I didn't know what to do because I was hurting. And I thought, if I'm a medic and I hurt, what about a layman?
Right.
What are they doing?
Tell me something. So these conditions that you've described, let's say the the aching nipples, maybe bleeding or they're leaking, and then maybe the lack of milk, breast milk,
Sure.
or maybe too much breast milk,
Oh, yeah.
all these conditions, and even on the baby's side, the lack of a desire to feed and all these
Yes,
things.
they do.
Are they a medical condition? Like, are they a sickness or an illness or a disease, or are they just what causes that? What actually is? What would you define it as?
Yes, it's not an illness. I wouldn't describe it as an illness because either it's lack of know-how or lack of support. When you look at our mothers, when they gave birth to us, there was a lot of support in the community. So here we are in the urban. The only person I know is my husband next to me, and neighbors and my church members.
And many of us know
And,
very little.
and when I
man.
ask you what am I supposed to do, or I'm hurting Victor, what am I supposed to do? And you start bringing in all sorts of ideas. They are all not wrong, but which one can you follow? Remember,
Right.
there's a neighbor telling you something different. Chama person is saying
Yes,
something
yes,
different. Your
yes.
colleague is saying something different. And they are all trying to help you.
Yes.
But where we come in is we say, seek for professional advice because you never go wrong. When a baby is born, remember, it's an art in terms of they need to feed. But they have this rooting reflex which tells them the breast is on this side, come on. But when they're sucking, it's actually the mother's responsibility to tell them to open the mouth for them. Teach the baby from birth.
Right.
Open that mouth for me, because if I put the breast in before the mouth is wide open like a fish, I'm going to hurt. And if you teach your baby, that's when the baby learns how to breastfeed. Number two, when they are pulling, they may pull the wrong part of your nipple and you hurt badly. Number three, when that milk goes in the system, being the first time it's going on or it's coming in, the first few months, and all parents, I'm sure everyone who is watching Susan here must agree that there's something called gas and colic. And so it's actually a monster for parents who didn't sleep last night or for the last couple of nights. They know what I'm talking about. This baby cries for about 3 hours continuously. So we come in two ways. We support the mother on how to breastfeed or to latch on well, because that's where the original problem is.
Right.
Number two, we come in and teach you how to massage the belly or the tummy. And how do you do it? Don't just do it because you do the wrong or the opposite and you do more worse or more harm.
Right.
Number three, we have this product that is coming to Kenya. Being the first time, it's a homeopathic product.
Right.
People who know homeopathy, it's natural ingredients, combination of 9 ingredients, which makes something called coric calm. It's
Right.
the first time it's entering Kenya, and you can contact us to get it. It actually works instant. When a baby is crying or has gas or has this colic,
Right.
and you give it at the start of onset of the symptoms,
Right.
the baby comes instantly or within few minutes from there.
All right.
Remember, parents are very skeptical about giving babies medicine
Right.
from the word go, because
Yes.
this is a newborn
A
baby.
newborn baby,
You
yes.
don't have to start medication from word go. So
Right.
we came up with this product, and we're going to distribute it in Kenya.
Tell me something.
Sure.
When you talk about infant massage
Sure.
or baby massage, and in relation to its feeding habits and the colic that you've mentioned, there are certain places where one should massage the baby, and there is a certain technique. Okay,
Yes.
you're an expert.
Yes, I
But
am.
what about, we're talking about a mother who's probably for one reason or another not able to access people such as yourself, people who know how to do it. And there are all those traditional remedies. You hear of people, women who say you should rub the back. Personally, I learned something,
Yes.
that you hold the baby to your shoulder and you pat and rub the middle to lower back.
Okay.
Pat and rub the middle to lower back. I'm not very sure how effective that is, but can you tell us, for a person who is not an expert, is it something they can learn to do? You know, for instance, if you're not able to access this, is it something as a mother or as a father you can learn to do, and therefore what is the right technique?
Sure.
Yes.
What you've just described, Victor, is ways of burping a baby. Remember, this baby has just breastfed, and we always say as experts or medics, this baby must burp, either within the feed or after the feed. Why? Because when this baby is breastfeeding or swallowing this milk from the mother, they swallow with gas, or and this gas goes into the system, and you have tiny particles of this gas, and this is what causes now colic. I'll tell you something. Our instruction or our teaching of baby massage is not particularly for a baby who is sick. It's actually for any healthy baby, and every baby deserves a massage. What you've just asked is there a technique? Yes, and that's why we are instructors. And when it comes to teaching or instructing a parent or a caregiver how to massage their baby, there are two options, like what we do. There's private sessions where Victor calls me in with the wife and this baby, and I teach you we actually group the sessions into 5, weekly apart. Remember, we don't massage your baby.
Oh,
we
right.
teach you how to do it, because tomorrow Susan will not be here.
Right.
What are you supposed to do?
Right.
So as much as I come in with a demonstration doll. I teach you, if it's a legs and feet, what are you supposed to do? If you do the professional massage,
Right.
and I come in here and I say, those people who get instructions on YouTube, they miss so much, because YouTube is not able to carry all that information in terms of you're not able to be shown all
Physically,
bits.
yes.
Remember, this baby, before we do a massage, must consent. The baby.
Oh, really?
Oh, yeah, Victor. People assume babies who are newborn, they have no sense, they're just lying there.
So
They
what
are
do you
able
do?
to
You
say
ask
yes.
the baby, hey,
You have
I'm
to-
going to rub you.
Yes.
Daddy is going to rub you.
Good.
Do you accept?
Oh,
So
yeah.
they say, what happens?
They smile.
Oh, they
That's one.
smile.
They coo.
They understand.
They do understand.
Right.
And you teach them,
Interesting.
because remember, massage is not to do and die.
Right.
They can accept, they can say a no.
Right.
If the baby says no, they will cry, they will turn off their face off you. Because when you are massaging these babies, the first thing we tell you is eye contact. Observe your baby. Either she's saying a yes or she's saying a no. If the baby turns to the other direction, Victor, this baby is not ready for massage.
Right.
And you wait until this baby is settled.
Right.
It could be she wants to feed before this massage. And they communicate, by the way. Did you know a baby talks?
Yes, they have a language that
They have a language.
unfortunately we have no understanding of it whatsoever.
Yes.
Right.
And when we come in, we have this series of 5 sessions which we divide. We say today we're going, because the tummy is really aching, or it's hurting, or this baby has colic, or this baby is having issues with digestion, or is not doing poo every day.
Yes.
We start with the tummy. And I'll tell you something, the strokes, the strokes are the methodology in which
Right.
you find there are about 48 in total, the whole body. So you
Wow,
cannot be
okay.
taught in one session.
one sitting,
You
yes.
overstimulate that baby, or you will make the baby hate massage.
Right.
So we say today we are just running the tummy and some exercises, the bicycle,
Right.
and this will help relieve any trapped gas. It will help release any poo that was on the way,
Right.
and it will help with digestion.
Right.
We now say the second week, which is the second session,
Right.
we are going to repeat what we did on the tummy,
Right.
and we include the legs and the feet. So we continue the next week, we come in and we teach you, we remember the tummy, the legs and the feet.
Right.
We include the chest and maybe the face.
The face.
And
right.
then the 4th session, we come in, we repeat everything else we did,
Yes.
and now we include the hands
Right.
and the back.
Uh-huh.
The 5th one, which is the final,
Right.
we do everything. That's
Yes.
a full body massage of the baby.
Right.
And if you have any questions, and we also certify parents.
Ah,
Oh, yeah.
wonderful, wonderful.
Yes,
Excellent.
our certification is international,
Right.
so globally we are recognized with that, the certificate I have,
Wow.
which we stand out, and we are very few
So
in
you're
Kenya.
qualified and you're certified,
We are certified
and therefore
internationally.
whatever service you give, whatever information you give,
Yes.
instruction you give is world class.
Yes.
Tell me something.
Sure.
When we're dealing with, you mentioned something earlier, because of the hormonal imbalance, a woman may have, a new mother may have either too much milk or too little of it. So how do you remedy that?
The main worry is not even too much milk. Those mothers with too much milk, they're like, this is good. But I've seen a lot of...
But imagine if the mother, for instance, goes to work. Then
Yes.
you're at the office, you're having a presentation, or maybe you're a presenter like myself, you're doing the lunchtime news or the 9 p.m. news, and you have full memories. And I understand it's a
Yes.
very uncomfortable feeling.
very uncomfortable.
So how do
It gets heavy,
Yes.
gets uncomfortable. You
And
have this
some of them actually
postal-
have leaking. They
They
start
do
to
leak.
leak. Yes.
They do leak.
So
And,
tell me, how do you deal with both extremes? Too
Yes.
much or too little?
too little.
Yes.
I'll start with too much because it's very easy. One, your breast.
Right.
Oh yeah, this is what we were looking for. Remember, every mother who is watching and they don't have milk, or they think they have less milk, or they think they don't have at all.
Right.
They are wishing, I wish I was that mother with too much. I'll deal with it.
Right.
But at times it gets too much,
Yes.
that it's uncomfortable for this mother. What we tell them, start pumping it out. Remember, if your breast or your mammary is full, before you breastfeed a baby, the baby will choke because the milk,
The pressure is
the
quite,
outflow
yes.
is too much.
Uh-huh.
So what we say, express a bit. Before you latch on, before you attach this baby to the breast,
Yes.
express to release the pressure,
Yes.
and then you breastfeed. And then express and start storing. Did you know the milk in a freezer, in a freezer, frozen, can stay for a year?
Wow.
Safe.
Wow.
We put it in a whole year.
Wow.
And we tell mothers, start expressing, because in a few months,
Right.
that hormonal change again will come in, and you start decreasing your milk production.
You're right. Right.
And we start telling them, but if they didn't know us or they didn't know what to do you know they waste?
Right.
I've seen a lot of people expressing and they pour the milk
Yes.
because they
yes,
didn't
yes,
have guidance.
yes,
Nobody told them
Yes.
this milk will be beneficial in 3-4 months.
Right.
Nobody told them.
Uh-huh.
But once they reach there, they're like, the milk that was flowing too much
Yes.
is no longer
Now
here.
becomes to decrease.
Is
and
it,
it's
is it
not-
stress?
Yeah. Uh-huh.
Remember, when this lady is also going back to work,
Yes.
at some point, a few weeks before, they
Yes.
start now feeling they're getting detached to their baby, and it
Right.
affects them psychologically.
Oh yes, and then there's some stress.
There's some stress. So
Yes.
they don't come back to the office happy that
Right.
they are there. They're very absent-minded
Right.
because they want to go back and
Feed the baby
Be
and
with the baby.
take care of the baby. Yes.
we go back to the other extreme, no milk at all.
No milk. Yes.
One, it's psychological because the way God made us, every mother should have enough milk for the baby.
Right.
Remember, if I
Right.
have triplets,
Right.
there'll be enough milk for the 3 babies. But what
Wow.
happens?
We are engineered to
We are
have enough.
engineered to have this milk.
Yes.
And it's all hormonal
Right.
contribution.
Yes.
If I don't have milk, or I think I don't have milk, the first thing is you need to be confirmed before that you don't have milk. Remember, a lot of mothers use a breast pump to check if I have milk. A breast pump can work against, because your psychology, how it works, once you touch your baby, is when the brain now makes more milk for this baby.
Right.
If I put a pump, the brain already says somebody's
It's a
feeding
pump.
milk.
It's
It
not
is
the
a
same
manual
sensation.
thing. It's a gadget. It's not a
Right.
baby.
Right.
So as much as you're pumping, you should not refer to what you see, like 20 mils, 30 or 60 or 100, to say
Right.
I have enough milk or I don't have milk.
Right.
What we say is, with the right nutrition, with the right state of mind, and with the right support from, the professionals,
Yes.
you should be able to have milk. And we come in and tell you, if you think you don't have milk, for sure, at times you can be